Now let's start with the first one of these disorders, which will be delirium. When you look at the definition of delirium, what you have is prominent disturbances in alertness, confusion, and it tends to be short with a very fluctuating course. And there's numerous reasons why patients have delirium, but the most common reasons are either A, acute metabolic problems, or B, substance intoxication. If you're looking at medical conditions which cause delirium, these include numerous disorders: systemic infections, metabolic disorders, liver disease, kidney disease, any kind of head trauma, any kind of seizure disorder that the patient will have. When you look at surgical patients, you learn that more than half of the patients who have hip replacement surgery end up with delirium. And that's also very important because in that age group, you tend to see more delirium than anything else. One of the risk factors for having delirium is that these are patients who are going to be given a lot of medications very quickly, or you stop the medication very quickly. For example, post-op, a lot of the elderly will experience delirium. Why? Because they're having an effect from the anesthesia. So it occurs in about 25% of the elderly patients, and some of the common presenting symptoms will be agitation or stupor. These patients, typically, we're going to get called from the psych point of view for their agitation. They're aggressive, they're hitting the staff, they're pulling out their IVs, they're pulling out their Foleys, they're pulling at themselves and doing all kinds of things. So that's why a lot of times these patients need to be placed in soft mechanical restraints. Many of them are afraid, many of them have hallucinations, many of them have delusions, and of course they do have disturbed psychomotor activity. They do see strange things on the wall. They do become paranoid. They do become suspicious. They believe that their family is trying to poison them, that the nurse is trying to poison them. So you'll see them refuse the medications. You'll see them refuse to take any kind of food because they're convinced that someone is out to get them and they're going to kill them. When you do a physical exam, what you typically can find are things like incoordination, you can find tremors, you can find asterixis, which is flapping of the hands. You can find nystagmus, you can find incontinence, and of course, if it's due to medical problems, you will find the medical disorders or substance-specific disorders. When you're going to do diagnostic tests, routinely most patients get either EEGs or neuroimaging tests. The treatment of delirium is to treat the underlying condition. If it's due to a medication, stop the medication. If it's because of anesthesia, chances are within days all of these symptoms will go away. Make sure that you orient the person, remind them what day it is, remind them where they are, remind them everything about the surgery or the procedure. Make sure you reassure them, make sure that they're safe, make sure that they can't hurt themselves. That's why restraints might be used. And if you're going to medicate them, you're going to medicate them with either high-potency antipsychotics or the newer generation of antipsychotics. And based on safety, the atypical antipsychotics would probably be the drug of choice. Now, the most common differential for delirium will be dementia, or it will be a drug intoxication or withdrawal, or some kind of psychotic disorder. So if you have a patient who's 75, who's never had any incidence of psychotic symptoms, now they're post-op, now they're having visual hallucinations, what are the chances that that patient is schizophrenic? Chances are that this is a patient exhibiting delirium from the surgery, from the anesthesia. You give them the antipsychotic for a few days, for a few weeks, and you'll see that all of these symptoms will immediately go away.